Okay, my name is Nekel Holbrook. I'm a third year medical student at the UT Health Science Center in San Antonio.
Hi, and I'm Alexis Lorio. I am also a third year at UT Health San Antonio.
Okay, so our project, as you can see, was titled United States Healthcare Burden and Patient Distribution of Inpatient Skin and Subcutaneous Tissue Infections during 2016 to 2020. We will, from here on out, be calling skin and subcutaneous tissue infections SSTI. Our project was a retrospective quantitative analysis on SSTI. So first we wanted to address why we chose to research SSTI. It was something that we were seeing a lot on our rotations, on our clerkships, that caused really lengthy hospital stays in a wide array of patients. And it was something that was really common and seemed to be really costly. And we were especially interested in the overlap between SSTI and public health disparities because SSTI is a largely preventable disease and it affects patients on all income levels. And so we hypothesized that there would be a disproportionate impact on those with less access to care. So our goal is to establish the costs of SSTI on the national healthcare system and evaluate how this cost was distributed among income groups.
So for our methods, we utilized a national database called HICCUP. This stands for the Healthcare Cost and Utilization Project. It's a collection of nationwide public databases provided by the Agency for Healthcare Research and Quality. We use their inpatient database, and that is organized by diagnosis to collect our data. So we filtered by patients with primary diagnosis of SSTI, and then between the years of 2016 to 2020, we looked at the number of discharges, which became our N, and then rate of discharges per 100,000 persons, and that was how we corrected for population. Then we also looked at length of stay, cost of stay, and charge to the patient. And then we repeated the data again while correcting for the community level income. And then again, for expected payer, we ended up taking that out of our project because it was just too much. So this project only looked at community level income, and then we used statistical Z-testing with a 5% significance level.
So as far as results go for discharges, we started there because we wanted to establish that SSTI is a widespread problem. And over the 5 years that we studied from 2016 to 2020, there were over 2.5 million discharges that were primary diagnosis of SSTI, which cost a total of $81 billion. So I think we can say it's a widespread problem. It's having an effect on our healthcare system. So we wanted to look at who it was affecting and how. So if you look at the graphs on the left, they address discharges, both total and per 100,000 population. And you can see that they are decreasing over time, which is encouraging. Interestingly, there's a pretty sharp decline in 2020, unclear if COVID-19 had an impact on everything, but how exactly COVID-19 affected SSTI admissions in the year 2020. We'll look at future data in 2021 and 2022 to see if that trend continues. But as you can see, there were a little over 500,000. There were 576,000 plus total discharges in 2016, and it dropped to 385,000 in 2020. On the bottom left, though, we did control for population in the different groups, which you can see kind of flipped the colors around for our low, middle, and high income community level groups. And you can see that it is most affecting low income groups, followed by middle, and then high income is the group that is least affected. So then we decided to look at costs and charges, how much it was costing a hospital and how much the patient was being charged per stay. On average, it increased overall. In 2016, it was $28,897. And by 2020, it had increased almost $8,000 to $36,754. So when we split it up by community level, income level by community, you can see that high income communities both had the highest costs and the highest charges. Low income and middle income, you can see that middle was a slightly higher cost, but when you looked at charge, it was pretty much the same comparing middle to low income. But overall, a definite increase despite the decrease in discharges.
So overall, as she was saying, SSTIs are an important cost in our healthcare system, and any measure we can take to reduce the number of discharges or cost of each day could be very impactful. And then for future study, we would want to complete our exploration on expected payer differences. And then we also are interested in correlating the data with geographical residence and available resources to different populations. And that's the end of our presentation, and we'll take any questions at this time.
Thank you both very much. Apologies again. I'm I'm juggling driving the presentations with the finding the presenters, and I didn't mean to exclude anyone. I thought it was interesting in terms of like a study design perspective. You touched on this a little bit, I think, when you said, you know, the COVID pandemic obviously affected the data that you were gathering in 2020. Is that the reason why you chose this particular time frame for the course of your study, or were there other factors as well to suggest that you not include, say, like data from 2021 or 2022?
That's a good question. So part of it is limited to the database, what's available. So I think we submitted this project in, I think December, and it was the week that the 2020 data came out. So the 2020 data, 2021 data probably won't come out for another 6 months or so. So that limited our data just logistically. But that's why next year it would be a good idea to look at the trends.